Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Ugo Ezema, a pulmonologist at Terrebonne General Pulmonology Care. The governor recently appointed and swore Dr. Ugo into the Louisiana Respiratory Care Advisory Committee. Today we will discuss the honorable appointment and what it means for our community. Welcome to the show, Dr. Ugo.
Thank you. Thank you for having me.
Well, congratulations on your appointment.
Thank you.
We're so proud of you.
It's an honor. It's an honor.
Well, let's talk a little bit more about that, but first, tell us about your role at Terrebonne General.
Of course, I'm a pulmonary and critical care physician here at Terrebonne General. I've been here for about a year and a half, going on 2 years. It's been a tremendous and rewarding experience so far, and I'm looking forward to being here for a long time.
Well, great. Well, now let's talk about the Louisiana Respiratory Care Advisory Committee. Can you tell us what it is?
Yes, it's exactly in the name. It's the Respiratory Care Advisory Committee that assists in helping the governor and the Louisiana government, essentially, and the Louisiana Board of Medical Examinees with taking care of and advising with regards to respiratory issues and problems that occur in our state. Well, more specifically, we help with organizing and keeping a lot of continuity and laws that help with the respiratory tech community and helping with their education and keeping up with their requirements.
Okay. So I know you kind of explained that, but can you tell us a little bit more about how does it help the residents of Louisiana?
Yeah, of course. So it helps the residents because you get, for the residents especially, you get some a semblance of consistency across the board. So all of our patients get a consistent type of care from your pulmonologist, from your respiratory techs, and make sure that they're getting high quality care and that the people that are becoming these techs and the people that are seeing our patients are high quality individuals and highly trained.
All right. And share with us how and why you wanted to be a part of this committee.
I wanted to further contribute to the community as best as I can. And I think this position offers me that opportunity. And respiratory, naturally, I'm a pulmonologist. I work with lungs and is a natural inclination for me. So I'm really happy to use my training to assist and contribute to the committee.
And how long will you serve on the committee?
It's a yearly assignment, if you will. And so every year, depending on how the rotations go, you'd have to, I may be re-sworn in, and I'm hoping that's the case. And I hope I do a good job and keep doing this for as long as I can.
And what are your duties going to consist of?
My duties are primarily to be in these meetings. We usually have them about quarterly, and they are available to be viewed by the public on YouTube. And we have that link on the Louisiana State on the Louisiana State website. So the public can watch those meetings. But the primary function is to be in the meetings and facilitate and use my experience and knowledge to help guide the decisions that are made with regards to respiratory care in the state.
So what are you most excited about serving on the committee?
Well, I'm just looking forward to the experience. It's definitely a new avenue that I haven't been a part of prior to this appointment. So I'm looking forward to the experience. I'm looking forward to learning. Every experience is a good opportunity to learn. And but most importantly is to contribute to the great state of Louisiana and to help to, push the state forward and make sure respiratory care continues on that path as well.
Right. And I guess being a pulmonologist and working in critical care, you get to see firsthand the needs of the patients and the techs that are working there.
Absolutely.
So I think that's probably why this is vital to you.
Absolutely. Absolutely.
And how will sitting on this committee help you in your practice?
On a personal level, I think it will just help me have a better appreciation for what our respiratory techs, one, go through to become one, and two, to be more mindful and cognizant about how difficult that job is. It's a challenging job in and of itself. And with regards to the ones that I've worked with so far, I'm tremendously thankful to them already. And I'm hoping, and I think this will help me on a personal level, have a greater appreciation for them. And on that account, be able to be a good advocate and a good ambassador for our respiratory techs here at Terrebonne General and with this position in Louisiana at large.
And just briefly, can you tell us, what do respiratory techs do?
Yes, well, they do quite a bit. They mostly work with our patients in the hospital, and there are positions that you can work in the clinics, mostly in the pulmonary clinic. But they help with doing pulmonary function tests outpatient. They help to give medications through nebulizers or inhalers, and they help manage the vents with the physicians that do put the vents in, put the ventilators on. They help us in the ICU, especially in the critical care unit. We imagine some of our sickest patients, especially those, like I mentioned, are on the vent and require high levels of oxygen support. Respiratory techs are really everywhere, really. They function as a very specialized type of nurse, essentially, if you will. And they do quite a bit, to be fair, but that's a good recap.
Okay. Well, thank you so much. I'm glad you're going to be having a role overseeing all of this for the whole state of Louisiana.
Yes, it's an honor. Thank you.
Thank you. For more information about pulmonology services at Terrebonne General, visit tghealthsystem.com. Thank you for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.